The knee joint, anatomically known as the tibiofemoral joint, is a synovial joint. This is specifically a modified hinge joint. This involves the tibia, femur, and patella. In this joint, there are two condyles on the distal ends of the thigh bone, anatomically known as the femur. These connect two concave condyles that are located at the proximal ends of the tibia. Right between the femur and tibia is a fibrocartilage specifically called the meniscus. This is there in order to absorb shock as well as prevent any collisions of the bones when partaking in activities such as walking, running, and jumping. The distal femur end is covered with articular cartilage, which is on the proximal end of the tibia. The tibia has two menisci, the medial and lateral meniscus. These are fibrocartilage C-shaped and attached to the tibia at its intercondylar area. This serves for two roles. It deepens the tibia's articular surface to increase joint stability, and it increases the surface area, hence serving as shock absorber. The knee joint comprises of two ligaments called cruciate ligaments. The ACL prevents anterior movement of the tibia with respect to the femur, and the PCL inhibits posterior movement of the tibia, also with respect to the femur. These are also held by fibrous capsules, the medial collateral ligament, otherwise known as MCL, for medial stability, and the lateral collateral ligament, otherwise known as LCL, for lateral stability. When these ligaments of the tibia are worn out, a medial meniscal tear usually occurs. Quadricep muscles stabilize the knee's anterior side. Gastrocnemius and hamstring groups stabilize the knee's posterior side. Also, greater joint integrity and injury resistance is when muscles strengthen.
Articulation is smooth movement within the joints. This image shows the inferior surface of femur and superior surface of tibia. The knee joint involves two articulations, from the tibiofemoral joint, which is the green region, and the patellofemoral joint, which is the red region, both being lined with hyaline cartilage that allows for smooth articulation and placed within a single joint cavity. The tibiofemoral articulation is between the tibia, which is the second largest bone, and femur, the thigh bone, hence its name tibiofemoral. It is the weight-bearing joint of the knee. The femur's medial and lateral condyles articulate with the tibia's medial and lateral condyles. Patellofemoral articulation is between the patella, which is a kneecap, and femur. The anterior surface of the distal femur articulates with the patella, or kneecap. The quadriceps femoris tendon is the knee's primary extensor. The patellofemoral articulation enables the quadriceps femoris tendon over the knee to increase the muscle's competence. The knee joint allows for four main movements: flexion, generated by the hamstrings, gracilis, sartorius, and popliteus. Flexing your knee joint is limited due to the calf muscles coming in contact with the thigh. Extension is generated by the quadriceps femoris, which is inserted into the tibial tuberosity. Extending your knee joint is limited because the knee ligaments prevent hyperextension. Medial internal rotation is produced by the semimembranosus, semitendinosus, gracilis, sartorius, and popliteus, all of which are thigh muscles. Lateral external rotation is produced by the biceps femoris. When a knee is flexed, medial and lateral rotation can occur at the knee joint, creating minimum range of rotation.
Another common injury during sports such as running or playing basketball, tennis, or soccer is a person with a torn meniscus. They can experience knee pain, swelling, and stiffness. In addition, the knee may give away or lock if a piece of the torn meniscus prevents joint movement. Surgical repair is sometimes but not always recommended. If your tibiofemoral joint is injured, you should never continue to do exercise or sports. You should wait a few days and give it some rest for it to heal. If you still experience severe pain, then medical attention is warranted.
Hey, Shabina, why don't you take a shot?
Sure. Oh no, are you okay? What happened? Is it your knee?
Okay, Shabina. So can you tell me some of your symptoms? On a scale from 1 to 10, how does your pain feel?
Like an 8.
An 8. So explain to me how you injured your foot.
As I was trying to make a goal, I actually injured myself and I fell.
So you were playing soccer.
Yeah.
Okay, well, to me, it looks like there's a little bit of inflammation. Does it hurt when I do that? Okay. Does it hurt when you flex it? Can you try it for me? Okay, that definitely hurts you when you do it. Okay. Does that hurt?
No. Oh, right there, right there, right there. Oh.
Well, right here, I can feel some inflammation. So this definitely looks like an ACL tear. Well, I don't see any kind of signs of fractures because I would have seen it on this x-ray. So it's definitely not a fracture. So we must take an MRI to see if it might be an ACL tear. Take an MRI and we're gonna see. But to me, this looks like an ACL tear. And if it is, I'll tell you what you need to do after that.
What is an ACL tear?
ACL stands for anterior cruciate ligament. This ligament is involved in stabilizing your knee joint, especially when you walk or run. It connects your femur to your tibia. It is common to injure when you suddenly stop to change directions, for example in soccer, basketball, or tennis. When the ACL is torn, you will hear a popping sound. Also, when the ACL is torn, you usually need to rest for 2 to 6 months. However, in some cases, you may need surgery. The recovery process usually involves physical therapy in order for the individual to gain their strength back.
I really wish we could play soccer, Shabina. Come on, you can't play at least one more game. Dr. Hannah said that I gotta rest, ice, compress, and elevate.